without further ado, then, it's my absolute pleasure to welcome Najla to deliver the Leverhulme Lecture 2024. Welcome, Najla.
First of all, I would like to thank Professor Sally and Professor David Lalo. I would like to thank LSTM team, all of them, and Habibati Liverpool as well for getting me, bringing me here. Actually, to come back to Liverpool, it was a very sad story. Because we are under siege for 10 years, so it is not easy at all to get out of the country. So a lot of work was done to bring us here. So thank you for them so much. I never dreamed that one day I will be back to LSTM. So today I will start to talk about what's happening over these last 10 years. I'm so happy to be and proud to be an LSTM graduate and to come back again to those people who loved me, who gave me the science, the knowledge, the everything, and then at the end also give us a hand in my country. So I really would like to thank all of them, everybody share us our sadness and before our happiness. Thank you to them, all of them. Thank you so much. So I will start now first our lecture. And so I will say a story about how the war exposed and exacerbate existing inequities and how war destroys health systems and causing health workers to leave and presenting those who remain with massive challenges and difficulties. Also, how solidarity and support can make a real impact. And you can see there is a big impact from small help. So if we'd like to talk a little bit about Yemen, how was before the war. Actually, we are one of the low-income countries with minimum things, but it is okay for us. At least there is some safety. There is our hospitals are funded by the government. There is salaries. There is peace. Yes, it is vulnerable, but it's okay for us at that time. But on top of all this, come war, will be the most scenario for us. So this is happy Yemen before, and now it is sad Yemen. Well, after the start of the siege, of course, you know that the story started on 25th of March 2015. In the very early morning, about 3 a.m., we waked up with the big sounds of explosions and bombing. We couldn't understand what's going on until we heard screams of the neighbors. We don't know what is it. One of my colleagues called me very crying and frightening. Oh, Najla, we are bombed by Saudi Arabia and Emirates. I said, what? Nobody believing that happening, actually. So this is the images that we wake up on that day. So bombing everywhere in the city, destruction everywhere, houses, farms, factories, everything, anything at anywhere. So they are bombing even without looking they're civilian or not. Anyway, the most important point here, our health system. The health system was really destroyed completely. As I told you before, we have a weak health system before, and after war, the things become more worse. So I am working in Al-Sabeen Hospital, which is just a few meters from a military camp between both of them. So every time this camp bombed, and that camp was bombed day by night. So every rocket come inside or bomb, all the glasses and the windows, everything is destructed. and people inside, children, pregnant women in delivery, so and stuff. So with each rocket and bomb, some women, delivered at corridors, running here and there, and children, some of them died, and with every rockets, all the staff running, just picking up those kids and trying to save them. So a stressful condition every day, every day. The health staff, when they start their morning, saying, "Oh God, maybe we'll be back to our home or not." But we have to go because there are some sick people and children there waiting for us. This is another hospital that destructed, as you can see. Also, we have a problem with the fuel. We are staying in these queues for a days, not for hours, for a days waiting, and this is make for us a big problem, where our health staff cannot reach. Some of them walking a long distance to come. There is no transportation. Also the patients cannot reach the hospital as well, and our hospital is still affected because we have a lot of equipment and fuel needed for the hospitals to work. So all these are shut down because of this crisis. And so people there is more hot areas, people start to displace, and Sana'a became so crowded with them. Before, Sanaa's population is about 2 million only, 2 million. So after now it is about 4 millions. So people coming from the other governorate, from the hot areas, more hot areas than Sana'a, and those, most of them living in a camps and in a crowded condition. There is no clean water till today. The water is in queues. They are put tanks and taking it from the street. So no clean water. A lot of people. We have problems with the vaccination, where people don't trust the vaccines because we have no fuel. So they said, "Oh, how this vaccine came, how it is safe for us." So people refuse to vaccinate. All these conditions create a good environment for the spread of a lot of epidemics. And then the burden on the hospital increased more and more. So we started to receive patients with cholera. Before, for me, for the first time in my life, seeing cholera cases. Before, we saw it on the TV in some of the crises in Africa, but to see. And by the way, Dr. Najla is the first one who discovered the first case of cholera during that epidemic. Yeah, he suspected, and we said, "Oh, cholera, we haven't before." But then when we said for an investigation, yes, it was cholera vibrio 01. So we start to receive a lot of patients, and Al-Sabeen Hospital was one of the centers that receiving the cholera patient. Our capacity in Al-Sabeen was not enough, so patient was on like you can see on the corridors, outside, in their cars. We put the IV line, everybody running by the IV fluid under the trees, everywhere. So we are overwhelmed with the huge number of patients with the cholera. This is one of them. So you can see here, this actually, this is not a urine sample. This is a stool sample for that girl. So patient from just one motion can get in shock, and which is so challenging for us. Also, another epidemic come to us, the diphtheria. Diphtheria also was spread in a very, because of the crowdedness, in a very huge way. And also for me, we never seen diphtheria cases from before. And even in our textbooks, I think the diphtheria and the whooping cough is not there at all at the moment. But actually, this is, as they told us, this is a disease 4. So every child, we look to his throat and we can see that white membrane in it, and send it for a swab, and was discovered to be a diphtheria case. Of course, we have a lot of problems because this disease need ICU, because there are a lot of sequelae, heart problems, neurological. Some of them came to us with the paralysis, paresis, myocarditis, a lot of things like that need these children to be in an isolation place as well. We have an isolation ward in Al-Sabeen Hospital, but we cannot receive those patients. So we have another place. The WHO helped us by doing that one, but as you can see later, LSTM and Habitat Liverpool helped too much in well equipped that place, and we'll show you later. Also, about a huge number of children has malnutrition, also the adults. You can see like that boy, you can count his bones actually. This is a marasmus case, and this is a kwashiorkor. The kwashiorkor is a protein deficiency disease, so a lot of patients coming with this type of diseases. The ladies there, because economically they have no money to buy milk. So what they are doing, they are boiling the rice, and then they took off the white solution from the rice and give it to their kids they had. So that's why they get in this. We have an area where we found girls and kids that are eating the leaves of the trees because there is no food. So because these areas, the AIDS cannot reach an organization, and AIDS cannot reach to it. So it is very horrible situation actually. Also, after finishing the hot period, then we started to found a very, I'm sorry for the next photos, a very strange diseases like cancers, skin problems, and congenital anomalies. For example, that boy, we did this one, we couldn't find any diagnosis for it. We don't know what is it. All his blood vessels are, swollen, his abdomen, everything, but nothing is going with a certain diagnosis. We have a lot of conjoined twins like that one. And some of them, we have one that we could save him up to 1 month, but then they need to be abroad to be separated, because actually a lot of their internal organs were one. And after complete 1 month, and with a lot of appeals from the WHO and a lot of organizations, and they could took them to Jordan to be separated, and successfully separated and come back to Yemen after 3 months. But by that time, one of them passed away actually, and the other one was alive. And we found before we very rarely to found these conjoined twins, but during this period it started to be common. Also, we have sort of problems, skin problems, like what you can see here, and some, like, I don't know, this is hemangiomas or what is it. So as I said, maybe anyone in the hall can help us if he is interesting, with help by investigation or by trying to find for us a diagnosis for these diseases. Oh, not working. Yeah. Similarly, here you can see things in the eyes, in the lips, in the nose. So maybe all this coming because from the chemicals, maybe, I'm not sure, but from the chemicals that bombed over us, from the white phosphorus. Actually, I have one student, master student, try to find out the load of the some of the metals in the soil, and we found that it is a huge number in the places that was bombed actually. Yeah, like lead and other heavy metals. Also, we have kids like this child. She has cyanotic heart disease, cyanotic congenital heart disease. This child, if in a normal situation, can be operated and can live for long and doing well. But unfortunately, because there is no facilities inside Yemen, she need to be go abroad to be operated. But because the airport is closed, there is no place or no way to get out of Sana'a. This is why a lot of kids dying early, while they can be operated and be treated actually. So the impact of this war and this situation on our health workers was we left it handless. Actually, we cannot appeal from anywhere on anywhere. We have shortage of drugs or medicines and the safe drugs, because all the original companies withdrawn from the Yemeni market. So we have few companies that can supply us with drugs, and some tradesmen, bring some drugs which is not safe. And there was an accident that there is one of these drugs for the leukemic children, methotrexate, expired, and they are used for the kids. And about 11 or 12 child was passed away from this drug. So people trying to find anywhere, anything to find a drug or medicines for their sickness. Also, there's a shortage of the medical equipment, especially during the COVID-19 epidemic. We needed mechanical ventilators. We needed a lot of respiratory assistant equipment. There isn't. We haven't even, the smallest thing like cannulas and, resuscitation drugs. We couldn't get it. We stand by our child. He's convulsing, and we couldn't, save his life or stop his convulsion. We have to write for him, go to bring it from anywhere far from any pharmacy. So when he go the patient and come back, the child has a very bad situation and sequelae. So it is very frustrating situation for us. Sometimes we stand crying for that child because we cannot help him. We have a lot of health workers get traumatized really from that situation, how we can help this patient. So many patients, a lot of type of epidemics, and we are handless. We cannot do anything for them. So also after some time, this hospital, our hospital before, was funded by the WHO, the UNICEF, giving some support, and some department like the malnutrition ward and the nursery was free of charge. And then after some time, because of political reasons, those withdrawn with their help. So the hospital started to ask the patient to pay money. So paying money is a big problem for our patients. There is no salary at all for all the people there. There is no any financial for them. So how to pay? We found some cases, some families bring their kids and put it and go away. They say we cannot afford money either to treat him or just leave him to die. Some of them start to pay things, but then after some while say, oh, I cannot pay anymore. Let me take my kid and bring him home to die there. So a very really frustrating situation for our health staff. Also, we have lost a lot of our colleagues, doctors and nurses. Some of them dying from the disease. Some of them died during the COVID-19 epidemic, and some of them from the cholera. Okay, so and some of them, they are because of the financial or economic situation. They try to get out of the country or going to another place in the country, because like there's still some organization like Doctors Without Borders working in some of the periphery hospitals. So either flying there or getting out of Yemen to find a job there. because they cannot stay. Some of them, they get out because of security. They are not secure inside Yemen. So we lost a lot of them. And the remaining, those who stand there, as I told you, they have no security. As I told you, they don't know whether they will go back home or will be killed anywhere in the street or inside the hospital. Actually, it happened that 2 rockets were thrown inside our hospital. One of them in the the blood bank of our hospital, and thanks to God it does not explode but make a lot of destruction. And the other one also was bombed inside a store. So we are not far away at all, not only from that military camp with the pressure coming or the pieces of any rockets coming inside, and we have a lot of the staff was injured from the pieces of the rockets as well. So so those who are remain under that situation, no security, no salary, and when we ask them how you stayed there with the situation, say because how we can leave our patient, and this is our work and our responsibility. We have to stay there. So also there is no any health insurance at all. They are working in between the cholera, in between the COVID-19 epidemics, those patients, but no any insurance for their life. If they get this disease, they get it. Even no medicine for them, even no place to be admitted in our hospital. And if they are admitted other hospital, they have to pay for that hospital as well. So also, as I told you, there be some of them or many of them are traumatized from the situation and the frustrating environment that they are working in. So here we will talk about the Liverpool solidarity. Actually, in the middle of this darkness, a beam of light came to us from Liverpool, a very noble person who was the first one to give us a hand. Prof. Luis Quez. I'm so sorry he's not here. Well, he keep asking about us by phones. I'm sorry. He keep asking about us, about safety. Sometimes he's hearing with us the bombing. So because you know, before this war, there is a bit conflict there between 2 parties inside the country. So he's following us all the time. And then we started by you know, a small group of and we call it Liverpool Friendship Group that is composed of Prof. Luis Cuevas and Prof. Sally Theobald and Dr. Rachel Anderson de Cuevas and Dr. Joanna Rabin and Helen Keller. This is started by the story of this child. He's 13 years old from Hajja. His name is Asil. Asil has intestinal TB. You know, Prof. Luis was very interested in that TB, and we worked together in a lot of researches in the tuberculosis. So I'm talking to him about this child. This child brought to our hospital. He tried to kill himself, suicide. As you can see the scar on his neck. He told me, oh, I couldn't end my life because the knife is not so sharp enough to finish it. So it is very horrible story. So once I talked to him about that and told him, oh, Prof. Luis, we have a lot of poor cases like that and this and this. Then he started to find help for us by this group of friends who then started to send us money to strengthen our health staff. So it is very small amount of money that we started to distribute it to our healthcare. Some nurses, we have about 4 nurses, 4 nurses in the emergency room and 2 nurses in the intensive care unit and 2 doctors. So about £200 every now and then we send it like monthly, and we give it to those to make them stay and work and be strong to face, you know, the situation. And then this is Dr. Roberta Patricia. She's working with the Doctors Over Without Borders, and she came once and visited our hospital to see the impact of this little amount of help. And this is her report in her name, in her words. You can see it. This is on March 2017. So she found a huge impact actually from this 200 pound, huge impact, because those nurses, by them, we increase our capacity. Before, as you can see in these photos, this is only our emergency room, only 10 small bed. Each bed can take only one child. So our capacity only 10 children, and we have a lot of diseases. And how so to increase the number? Then by increasing this, by giving the incentive for these nurses, we have a small area. Before we use it for observation only, but we put 3 beds, and each bed take about 2 to 3 kids. So we increase the number. Also, we have we furnished a small room and make it like a CPR room. And here, this is our nurse Adham. He's one of the nurses that we support, and this is Dr. Patricia. So before, we are doing the resuscitation in front of the patient, in front of the relatives, anywhere, because we have no place. But after doing that one, then the things become so good. Also, this is here a very old balcony, which is a lot of dirt and just like nothing. We clean it, and we brought 2 beds, actually 3 beds. Each bed will take 2 to 3 kids there for, you know, cases like needed intravenous fluid or blood transfusion or things like that for observation. And also this nurse Hayel, also the one who we are supporting. So in this, by supporting just 4 nurses, we could operate 3 additional rooms to our ER and increase our capacity to receive more kids. And here, this is the ICU, our ICU. Before, it was that one, very small area with only 2 beds, and it is also neglected and lot of dust. But then we clean it, and we support two nurses to work in it, and then we increase our capacity of the intensive care unit. And here it is after the development of it. So this is the first early nurses that we are supporting in Al-Sabeen. Oh, then the help became. So now we have a new era of support, Habibati Liverpool. So the fund increased from 200 to reach up to 2,000. And now we are supporting not only 6 nurses and 2 doctors. Now we are supporting 40 nurses, 20 at Sabeen and 20 at Thawra Hospital. We extend our the support to 2 hospitals instead of 1, and a lot of nurses. So those are our friends. Yeah. Those noble people, generous people who are stand by us, and of course LSTM, guided by them as well. So those start to collect for us money and increase the fund. So this is most of the activities that they are doing to collect fund for us and send it. You can see a lot of activities, small one. This morning we have one. So, and now this is part of the new team, the extended team of nurses that we are funding. So not only incentives for the health workers, no, but more than this, For example, there they start to pack for us clothes for our kids, especially those in the malnutrition ward. And so here how they are packing the things, and the other photo is reach to the hospital and bringing it back. And here, this is one of the kits that we gave him. This happened also during Ramadan and before Eid. So the kids are so happy to have these new clothes. Yeah, and some toys as well, not only to look cloth. Also during Corona or COVID-19, they send us BBE for us BBE for all our hospital, not only the pediatric department, but for all our hospital. The hospital cannot afford us any protection, any sort of protection, no vaccines, no BBE, nothing. They are giving us one glove. The morning when we came in, just one glove, you have to use it all the day. So each one has to protect himself by himself. So Habibati Liverpool and Liverpool support give us this. More than this fund, this help, they bought for us equipment, very valuable equipment. This is ultrasound. Thanks to Sabia, she worked hard to find this for us. This ultrasound can guide to how to put central line because a lot of baby, as you can see, very thin, and it's so hard to put for them peripheral line, and we need to put a central line for them. So our team is not expert in putting it, and we needed to be guided by an ultrasound apparatus. So they give it to us. Also, they bought for us 2 Hamilton mechanical ventilators for our infectious ICU. This is the one now we are concerning with it because all our problem are infections. So the diphtheria cases, the whooping cough cases, all of them are get a lot of benefit and survive, as we can see from our from the next slides. Also the measles. Actually, the measles till this moment, we have a lot of measles cases, and all this because people refusing to be vaccinated, and some of them because as I told you, they lost their trust in the vaccines from the beginning, and some of them because it is difficult to be reached for the places to have the vaccine. So Habibati, as I told you, has bought valuable medical equipment for us, like 2 mechanical ventilators and 1 ultrasound, as you can see, and also machines for chest physiotherapy. And we equipped 5 points for CPR. Our pediatric department at Al-Sabeen Hospital is so big. We have like 5 wings, so we make a room at each one, because if a child had any problem, to take him from the ward running to the ER, it's a long distance, so he will die in the way. But we create point for resuscitation at each wing, and then from the fund that they send it from here, we put all the equipment that needed and the drugs that needed for resuscitation in that place. So also this is happened for us. Right. So you can see now the impact of all this help and support for the quality of our work. We received a lot of patients. We now at Al-Sabeen Hospital actually expanded and became like the biggest pediatric hospital in the Republic, if not only in the north. Yeah, and it has very extensive intensive care unit, and it reached like now 23 bed, and like 10 bed for the infectious. So this is a case of diphtheria. See how the child was, and here on discharge, and this child as well, diphtheria, how he came with paresis, and now he's so fine. Also, this child has meningococcemia, and although she has a gangrene everywhere, but fortunately she she get out of the amputation of a small finger, but she was saved. And this child has measles also, and then that her case when she was discharged. Another case of measles. Yeah. So now we have to go for the last section, compassionate leadership. Working? Yeah. So the ways that we use to support our health workers at Al-Sabeen Hospital, that first of all, we're standing side by side with them. We never left them alone. I never ever, during all the whole period, take one day off holiday. So all the time we are there in the hospital. Uh, so being together under fire, this gives them a trust to stay. Also, this is what I'm saying, leading by example. So I cannot say to them, come and I'm at home or away. So, and also we start to encourage them to come to work and emphasizing the importance to being there for the patients. Also standing by them during a hard time. For example, if they are sick, we are going to visit them, we are giving them help, okay, and buying for them medicines. If they have any, for example, a dad or a mom have a problem, we stand by them. So all this supporting them. Also by developing a trusting and friendly relationship with their families. It happens that well, we have one nurse that her family asked her not to go for the hospital because not secure and these things, and Dr. Nasher talked to the mothers and the father, and convinced them that the girl would be okay and these things. So we make a relationship even with their families, not only the health workers. So, and they are in turn support and encourage us when we see them. They are standing there strong. So this is give us more strength, and we continue working with them. So regarding the gender issue, actually women always juggle many responsibilities. She is a mother, she is a wife, she is a worker as well. So for these reasons, we support women to help with this burden of hard works. So the hospital provide them transportation and the meal note because no resources. Also, we are allocated the lead days for the night for the day shifts, while the male nurses for the night shift. And our patient actually also grateful to female nurses and give them more respect because and their appreciation their efforts because of hard many works here and there. So. If you ask me who support me, we are supporting them. Actually, people in Liverpool, both LSTM and Habitat Liverpool, and my family, those are the strongest two person who support me. And then my love to my country also give me the patience, give me the strength to be there and to help our people. So now we get into a better position apart from just help and these things. We get to further to study our situation. So we have with also LSTM the rebuild talking about the resilience with Dr. Wissam as well, and we have a research say about new study about mapping the resilience capacities and coping mechanisms of all of health workers in emergency department in hospitals in Sana'a, Yemen during protracted conflict. The aim of our study is to understand how health workers in two hospitals in Sana'a, Sabeen and Al-Thawra Hospital, how they are coped during war, how have they remained resilient, and to co-develop low-cost ways to help health workers respond to shocks and how can we help health workers both in Yemen and in other conflict-affected settings cope. So I think this research will be so good to bring a big lessons for any place with war. So today I talk to you about how war expose and exacerbate existing inequities, how war destroy a health system, causing health workers to leave and presenting those who remain with massive challenges, and how solidarity and support can make a real impact, and how we need peace in Yemen. This is the most important one. So what you can do to help? Maybe first of all, you have to call for peace for us. This is the most important. And then we're looking for partnerships, for education, for medical support and advice, for laboratory facilities, for research, for community support. Really, this is what we need. Big thanks to LSTM and Liverpool. And really, I'm so proud that to be an LSTM alumna. Thank you so much.
Thank you for that fantastic Liverpool support. Yeah. And I think we were all moved and amazed by the incredible passion, commitment, inspirational through the most challenging of circumstances. And I'm speaking for LSTM, we are really proud that you're both our alumna. And speaking from Habibti Liverpool, we're really proud to work in partnership together. So thank you so much, Najla, for an inspirational Leverhulme lecture. So colleagues, we have some time for questions, so we can take questions in the room. We can also hear any questions online. So who would like to start? Welcome, Kat.
Thank you so much. That was just so inspirational. There must have been times when you've found it hard to cope and wanted to give up. And where did you get the strength from to continue?
Najla, should we take that one now and then we'll take a couple more? Please go ahead.
Okay. So as I said here, I got my strength actually from those people in Liverpool, first of all, and from my family. Yeah, because without their support, I cannot support those health workers. So they need money to work. So once they said that we need medicines, we need equipment. So I have the strength with these things from Liverpool, and emotionally also from my family by encouraging me to go there, to be there, not to fly away. Although I have a chance to fly away, but I didn't. Yeah.
Any others in the room?
All these things. When you are faced with the situation to do this, or how do you decide?
Sorry,
When there's so many priorities,
yeah.
how do you decide?
Yeah. Well, actually, when you've been there, you will think always your priority for your patients. So this is what let me put it in the first top in my life, to be there, to help the health workers, to stand by the patients. So this is what make me. I know it is so hard, but we have to. When you save kids, when you see how you help those people, when you see the happiness when they give them anything, this is will give you a big power, yeah, to stay. Yeah.
Okay.
Thank you for a wonderful talk, Najla. One of the things that strikes me as the children come through, you must see a real growth in children with disabilities. And how's your work been impacted by that? How have you had to change the way in which you function because of that? For disabled children?
Well, yeah, actually, because of war, we have a lot of disabled people. And in our hospital, there is, we have a surgical ward. Before it was a surgical ward, but they converted it to for injured people from the war. Yeah, and you know, it is a very sadful view when we see every day people coming with one leg, without legs, without any limbs. Yeah, so there is a rehabilitation place for them and surgical care for them as well. Yeah.
And here's Pfizer, who is the one that organised for the transportation of all of the big bags we saw going from Liverpool to Sana'a.
I'd like to say on behalf of everybody that's been connected or heard of Habibti or took part in every little bit of contribution, whether it's financially, whether it's coming to my house to fold the many clothes, and also like for my husband who's been putting up with the living room because he didn't have a living room for 3 months. I'd like to say welcome, Najla, to Liverpool, to the UK. And it's been an honour to be part of the whole, you know, LSTM. I call it LTSM. It's my dyslexia. And to Louise, to Seba, to many people in the room, which, believe me, you are on my mind. And thank you for hosting me and my cousin when we went to the hospital. We actually didn't want to be dropped off outside the hospital. We wanted to take the long road leading to the hospital because we wanted to be a part of those that do come to the hospital. And some of them cross, what, 3, 4, 5, 6 hours just to get to the hospital. And we wanted that 20-minute walk. I wouldn't mind a 20-hour one, having seen beautiful Yemen. But it has been a very, very satisfying long journey to be part of, you know, even like sending premature baby clothes. And there was a lady here whose mother knitted them before she passed away. Louise will know more of that. And for me to transport them tiny clothes that were knitted by a lady who's passed away to the children of Yemen that actually fitted, they were that big. The hats were that big. You know, but there's many things I could say, but I just want to say, you know, thank you to everybody, and welcome, Najla.
So we'll take a final online question and then we're going to close the Q&A. So welcome, Hannah.
Fantastic, thank you. We have a question. We have a couple of questions online, but the one that we'll have time for perhaps is one of our guests online have asked strategies be used to encourage the uptake of vaccines in Yemen if the situation becomes stable.
The vaccine.
Uptake of vaccines.
Oh, really? Yeah. Actually, any woman or mother refuse when we ask her if you vaccinated your child or not. This one is okay. Okay, thank you. Yeah. And she said, no, I'm not vaccinating my child. So we try to explain to her the importance of that. Especially now we're seeing a lot of measles cases, and we're telling her if your child was vaccinated, he will not be here in the hospital. So please, and some of them, you agree that they will change their mind. So yeah, by talking to them and trying to encourage them to vaccinate their kids. Yeah.
Okay, thank you so much, Najla. So I think we need to close now for questions, but thank you very much for the questions, for the reflections, for the welcomes. And I now want to hand over to my director, the director of LSTM, Professor David Lelou, who will present a medal, I believe.
Najla, can I add my thanks to those of Sally for a truly thoughtful and thought-provoking talk. It's just absolutely amazing. And I'm delighted you're proud to be an LSTM alumna, but LSTM is incredibly proud of you as one of our alumni. I hope you can sense tonight the warmth in the room, the support you have here, because what you've achieved is truly amazing. In those kind of environments, to lead such a team is fantastic. And the Leverhulme Lecture is one of our most prestigious awards. I think it's very difficult to imagine a more worthy awardee. So thank you very much for the true, and here is the 2024 Leverhulme Medal.